Thank you for joining us today. So again, I'm Dr. Hurley, and today I have the opportunity to interview a patient of mine. She's a very sweet lady. I've known her for years, and it just so happens that she's agreed to come in and do this interview and talk about her treatment. So thank you. Yeah. So I wrote down some questions.
That's good.
Because I thought, well, some of this will be fun. So question number one is this scripted?
No. Do you have to have that thing saying, I am not a paid actor?
You are definitely not a paid actor. That is true. Unfortunately, I'm not able to pay you today.
No. That's what my husband says. It's going to be, I am not a paid actor. Right.
And how many times have we rehearsed these questions?
Ooh, none, zero. I'm in for a surprise.
Yeah, that's right. What about this? What were you doing when I called you and asked you to come interview?
I was in Hawaii.
I know you were in Hawaii.
Yes,
so what were you doing there? You were visiting family?
I was walking through the PX.
Oh, nice.
And I was like, what are you doing on my phone? I was like,
wait, so you recognized my phone number?
I have you in the phone. I have you in my phone.
Wait. So let's back up there. So how did you know who was calling you?
Because I have you in there as Dr. Hurley.
Oh, so you have my cell phone number saved in your phone. Interesting.
Yes.
Yeah, yep. I do give my cell phone number out to patients. Yeah.
And I just have it saved. So I said, well, if I ever have an issue, and I haven't, so.
That's cool. So when you travel after spine surgery, are you in a wheelchair or in a walker?
No. In fact,
you're not. Well, then you have your cane, I assume.
No, I'm not anything. Are you kidding? No, I don't need anything. I'm so proud of the fact that I can walk just the first day after surgery.
Yeah.
That I sat up.
Yeah.
Pulled myself up on a walker, and I was like, I'm standing straight up. And it doesn't hurt.
Yeah, standing up straight.
And I said, okay, I have a lot of anesthesia in me. But no, it's already been over 24 hours. I got up, walked all the way around the nurse's station.
Yeah, that's right.
Crying because I was so happy.
Oh, that's good.
And
that's awesome.
From then on, it's straight up.
That's good. Do you remember how long ago we met?
Well, for the surgery in the ER?
Yeah.
4 years ago.
4 years ago. Almost 4 years to the day.
Yeah.
Yeah, it's pretty cool. I was kind of curious. So what made you come into the ER that day?
I had been through so much PT, and my husband was going to bring me, but he had just had gallbladder surgery. He had gallbladder surgery. He couldn't get up. I got up. I went and took a shower, sat on the shower floor crying. I said, I'm going to make it to the ER.
And you were crying because
it meant pain.
But where was your pain?
In the back.
In your back.
And I couldn't stand up.
Did you have? Yeah, I was gonna say, did you have any pain in your legs?
I couldn't feel. Well, it got to the point where, and I told you, I couldn't feel anything from the waist down.
Oh wow! So that was that like a first time thing?
Yes, that's what made me go, okay, I'm not feeling anything from the waist down. What is going on? It used to be just the leg was hurting, or just this was hurting, or the hips were hurting. I was overcompensating on my walking of the pain, so it was causing my hip problems.
Right.
And so then I just got up and drove myself to the ER.
Oh wow!
Very slowly, and then I stood there. You know that big driveway from the ER to the front door from where you park. I seriously considered throwing myself down, thinking, how long will it take for them to come get me? It's like, I seriously doesn't. Okay, I think I can make it over there. And I just bent over, walked over to the front door, and I told them I can't go any further. And they came and they got my wheelchair, and they rolled me back.
So you were having a lot of pain. Like, would you say you were in?
I would have rather had a child.
So like on a scale of like 1 to 10, with 10 being like childbirth, how bad was your pain?
Oh, I probably would have had 20 kids because it was so bad. And I'm not one to complain. I'm not one to, I'll usually if I'm sick, leave me alone. I'll chug some NyQuil and go back to sleep, but leave me alone. And no, and I kept telling my kids, something's wrong. I used to walk 3 and 5 miles, and they say, you need to get back on walking. You need to get this. And
I think I remember, was your son there with you too? Yeah. I
was there. Yeah. And I said, no, it's not that. Y'all don't believe me. I said, it's something going on.
So you really didn't know what was going on?
No.
You had no idea?
No.
Okay.
And I didn't think it was going to be emergency back surgery either. Thinking about it now, I'm like, I couldn't have woken up. What if it didn't work? All these things, and I didn't care. You were going to fix me. That's fine. I was taking a chance.
So you had never been told you may need surgery? Never had any idea?
Never.
Okay.
They said it was a sciatic nerve.
Okay. So you had been told you had sciatica?
Yeah. And it was.
Okay. All right. Did you have to take any medications before you came into the ER? Were you using medications on a regular basis?
The only thing I took was ibuprofen.
Ibuprofen?
Didn't touch it.
Yeah. Didn't help your pain?
No, not at all.
Had you ever had you said you'd been to physical therapy though?
Yes. And the only thing that helped was that table where they strap you down and they stretch you out.
Oh, okay. Yep.
And then they would slowly, and I was okay for a couple of days.
So they put you on the traction table?
Yes.
Okay.
And that was the only thing.
That would help you?
For maybe 1 or 2 days, and then the pain was back.
Well, good. All right. So some of the treatments that you received maybe helped a little bit, but it didn't last very long.
No,
not
at all.
That's unfortunate. Okay. Were you scared about the idea of having surgery?
At that point, no.
No.
I just wanted something done.
I
just wanted something done. And you were so reassuring that I was like, okay, he's going to fix it.
Okay.
And when I woke up, he fixed it. I was like,
well, it's funny. So I actually say, I cannot fix you. What I say to patients a lot of times now, and maybe I did or didn't then, I don't know. But what I try and say now is I'm going to do my best to help make you better. Right. But I'm not God. Right.
No, but the quality of life that you gave me.
That's good.
Look, I was in Hawaii for 3 weeks.
That's good. I'm jealous. Next time I want to get an invitation. Okay. And have you ever heard bad things happen to people who get spine fusions?
All the time.
Really?
In fact, we had a little reunion after my surgery, and
like a family reunion?
Yeah, and there was friends and all kinds of people there, and they were all, don't do it. You're going to mess yourself up. Don't do it. Don't do the backs. I mean, all of them. I said, it's too late. I already did it. I was like, and I am fine. And they had such bad experiences.
Really?
Yeah.
People in your family?
No, they were just friends.
Friends.
That had bad experiences.
Wow.
And I was like, I had a great one. I had a great doc he knew what he was doing.
Well,
so I'm sorry yours didn't work, but mine did.
Well, maybe we need to see them. Try and help them. Do you remember what kind of surgery you had? I was just curious.
What, on my back?
Do you remember do you remember what it was called or anything like that?
No.
Okay.
I know you fused and you said you put together and the nerves were doing good. And I was like, okay, I know I didn't have feeling from my knee down when I first got out.
Okay.
And you told me just wait.
Give it time.
And I got back feeling all except the little bottom. And it just feels like it's asleep. A real dull asleep.
So you still have some numbness in your foot. Okay.
But it's tolerable.
And you're 4 years out.
Yeah.
So
but it was from the knee down.
Yeah. So it's gotten better.
A lot better.
Okay.
So.
Yeah. What about this? Do you remember the level of the surgery that we did? Do you remember the lumbar level? Okay, so we did for you. I went back and I reviewed.
I know you did a lot.
I went back and reviewed our notes. So you had a grade 1 spondylolisthesis at L4-5. So L stands for lumbar, right? So we worked on your low back, and we did a minimally invasive transforaminal lumbar interbody fusion. So that's what we did for you. Yeah. So it's kind of a mouthful.
Yep.
That was the surgery that you had. And I have some pictures of you before and after surgery here saved. So we'll put those on. Are you okay if we put those on so people can see? But because I think it's really impressive when you look at your images. I mean, you definitely can see that you were not able to stand up straight before surgery. And then you also had this scoliotic curvature, to your spine. And we were able to, address both of those issues. Now, sometimes when I go to meetings with other spine surgeons, we'll talk about, interesting cases or complex cases. And I remember one time I showed your x-ray to a whole room full of neurosurgeons and spine surgeons. And I said, okay, and we kind of do this thing where we present the patient. We talk about your physical exam. We talk about your pain. We talk about your symptoms. We show your x-rays. And then we don't tell them what we did, right? But we ask the room, we kind of polled the audience, if you will, what would you do for this particular patient?
Right.
And do you know that people said, oh, you needed a massive surgery? Did you know? I mean, you probably didn't know that. But people said, oh, that woman's going to need, multi-level fusion done, all this. Yeah.
Oh, man.
And then I showed them
what you did.
We did a single level and we did it minimally invasive. And It worked.
Yeah.
Yeah. Anyway, so I think that's kind of interesting.
It was, believe me.
Okay. So, was surgery painful? Can you talk about that?
No.
It wasn't.
I didn't feel anything. What the last thing I remember before the surgery was being in that waiting area.
Yep.
And they had me flat on my back.
Yep.
And I was crying. And I could hear them, talking over at the nurse's station, like little counter. And they were laughing and giggling. And I finally looked up. I said, "Can I get some help?" And then they came and they gave me some pain medicine. And that was it. Next thing I knew, I woke up.
Then you woke up.
Yep.
So I did go back and look. So we did give you some pain medication intraoperatively, some local anesthetic to kind of help with your pain after surgery. So it seems like that may have been useful.
Yes.
Yeah.
Made me, yes.
Okay. Good.
The worst thing was, the worst pain I had after surgery?
What?
Those tiny little pain pills will get you constipated.
Oh, yes. Constipation.
Oh, that was
the worst.
I didn't have any back pain.
Oh, yeah.
But I felt that.
The constipation was terrible.
And I was drinking water and juice and prune juice.
Maybe I need to do a better job of treating constipation.
Yes. Well, and then I wasn't drinking a lot of water because I was like, oh man, I'm going to have to go pee. Do I have to get up? I don't want to. And then, but I should have, because it really wasn't hurting.
Yeah.
So I was just scared. I remember coming into you the first checkup and I had the walker and you looked at me, you said, "Do you need that?" "No, but I don't want anybody to run into me."
Oh, yeah.
It's like, and it hit me.
Yeah, right. Yeah. You can
so it's like, I just bought it because I just, people get away from me when you're in a walker.
Yeah, that's true.
They'll let you go. And I'm like,
stay away.
So I was okay.
Yeah.
So
that's a good point. So would you say, are you glad that you had surgery?
Yes. Yes. Thank you. Yes. I would do it 10 times over if I knew.
I'm glad you had a good outcome. I really am. And then I was going to ask you, how far can you walk now? So you were just in Hawaii.
Oh God.
And you were telling me that you were
2 miles a day.
2 miles a day.
Yeah.
Okay. You were telling me that you were at the North Shore.
Yes.
And you were looking at the swells and the waves. So did you walk some that day?
Yes. We walked all the beach line.
You did?
Yes.
How was that?
I had come to realize that I cannot wear shoes without a back because it will affect my hip.
Oh, you mean like you need to have like a full shoe?
Full shoe.
Yeah, not slip-ons.
If I have a full shoe, I can walk forever.
Okay, good.
But if I have a slip-on, then I can only do it a certain amount of time because because I don't feel this foot. Sometimes I lose the shoe and then I don't feel it. Yep. So I'm trying to overcompensate to keep it and walk straight, but it's causing problems. So I said, no more slip-ons, just tennis shoes.
Do you do anything else? Like, do you ride a bike or anything like that?
No, I haven't. But I'm looking into, and this is hilarious. I'm looking into bungee fitness.
Bungee fitness. Well, you're going to have to educate me.
They tie you up in a bungee cord, and then you just walk up. You can do your squats, but you have the help of the bungee.
Where is this?
I have seen it online, and I'm going to find it here in San Antonio. You watch.
Interesting.
But I want to try it. So,
yeah. Well, I want to hear more about this.
And my kids are like, "You're going to face plant." I said, "Yeah, well, if I face plant, I guess you're going to be there to pick me up, huh?" I said, "I just might, but I'm going to try it anyway."
That sounds very fun.
So, and it's like not so much like pounding on the knees.
Oh, I see what you mean. Yeah. It kind of takes away some of the gravity.
Right.
So it's not so much pressure on your joints.
Yeah.
That sounds fun too. Do you have to take pills now on a daily basis?
Just for my regular, I have high blood pressure.
Well, I mean, but for back pain or leg pain or anything like that? No,
never.
That's
I
good.
take pain pills for a headache
Sure.
But no, not for my back.
That's good. What would you say to somebody out there who's scared or thinking about having surgery or doesn't know what to expect? Do you have any advice? I know I've asked you to talk to a couple patients in the preoperative
Don't wait.
period.
I waited. I caused this own damage because I waited too long. I should have come in sooner.
Yeah, but I mean, people are scared, right?
I was too.
Yeah,
when
I'm
I
sure,
came
exactly.
in, I was sitting there like I told you, I couldn't feel anything from the waist down. I didn't know what was going on. I said, I might be raw for all I know. I don't know. It's been horrible.
Yeah.
But if you wait too long, you're just going to cause more damage to yourself.
Yeah.
And go.
I remember one thing very, I remember this image in my mind when it comes to your case. I remember I was seeing you in the emergency department. I think this was around the time of COVID too, wasn't it? Yeah.
Mm-hmm.
It was March of 21. So yeah. I mean, there was still COVID. Yeah. But I remember walking in and you were in on the stretcher there in the emergency department and you were just you were in a lot of pain. You could tell. I mean, you were kind of curled up in a ball on the stretcher, and I think you were even crying.
I was crying the whole time I was there.
You had just your son there, and I want to say your husband was there.
Yes, he was there.
Your family was there with you, and normally, like, I'll be honest, like when I see patients on call, like, if it looks like, we need to do surgery, then, so be it. But sometimes, with degenerative conditions of the spine, we try and treat it non-operatively, initially. But in your case, I don't think that there was a way we could have done that. You know what I mean?
Yeah.
Yeah. And so anyway, I'm glad that we were able to intervene, and I'm glad it's been a big difference in your life. I really do appreciate you coming today too. It means a lot.
You did I tell you gave me my quality of life back. Bottom line.
Pleasure. That's my job.
Yeah. And you say you didn't fix me? You fixed me. You did fix me.
This is not good for what I'm trying to promote here. I try and tell every patient, like, look, I mean, because the truth is like
every case is different.
Well, but not everybody has like an amazing outcome, right? I mean, clearly you've had a really good outcome, right? And so what I try and tell folks is like, look, I mean, I'm not a miracle worker, right? I'm just a surgeon. So I do what I think is, the best operation I can for you. But I can't like turn back the hands of time, you know what I mean?
No,
so
it's true. There's it's way too long.
Yeah.
Don't do it, because like I said, I should have come in sooner. Yeah. And maybe I would have still had this, but it doesn't matter. This versus that, I'll deal with this.
Yeah.
This is nothing.
Yeah.
I know a lot of people say, "Oh, I have neuropathy." Yeah, well, I do too, but you know what? It's not that bad. I'm doing good.
Good.
As me and my husband say, you know what? We're blessed. We're pretty healthy compared to most.
You have a really good outlook too on things. You know what I mean? Like you have a tendency to like, it seems like just in like listening to you talk, you have a tendency to kind of like see the positive aspect. I mean,
try to.
You mean you have like, you still have like a problem with your foot, but yet you turn it around and say, well, at least it's not as bad as it was.
Yeah, no. And then, because I've seen how you told me, just wait, it'll grow,
yeah, you do have to give it time.
Back. And it did.
Yeah.
So that's just the bottom of my foot, and I'm okay. But now I know that, age, and because I can't feel that and keep my foot on, I overcompensate to do that, and I was causing my own. Remember I told you I think I have hip problems, and I was in Hawaii. I said, you know what? I'm not going to wear flip flops or anything anymore because I'm doing it to myself. At the end of the day, I was hurting.
Yeah.
But if I wore my tennis shoes, I was fine.
Interesting.
I said, you know what? I'm just going to try it for a little while and just wear tennis shoes and see if that's a problem. I'm pretty
I hope
sure
some of my patients will take your advice, because a lot of my patients wear flip-flops. I'm like, you probably shouldn't wear flip-flops.
No. And they're hard, and it does cause pressure on your hips because you're trying to keep the shoes on, you know? Yeah. You're trying to compensate. And I didn't realize it till it started hurting. I was like, okay, no more flip-flops. I was like, that's it. I'm going to take care of myself.
Good.
So.
Well, we want to say thank you for watching us and joining us today. Do you have anything else you want to add?
No, except that, you saw me when I came in bent over. You saw me when I walked out straight up.
Yep, that was good. Very, very heartwarming story. So thank you again.
Thank you.
Yeah. All right. Bye.
Bye.